Okay, we're on. All right, this is a presentation on ski width and knee kinematics. Um, this is basically just a summary of the work done with Zorko et al. And a little bit of conversation around, skis and knees, basically. So, so looking at the knee joint here, we'll just cover a few of the big players that we're considering in the ski world. This is a view of the left knee from the front, or the anterior view, and the kneecap has been removed and is hanging down here. Really the big concern here is the ACL. The job of the ACL is to prevent the tibia right here from moving forward, which would be into the screen, or excuse me, out of the screen as if it's coming towards you. We also have the MCL, which is part of the ski conversation, and this is preventing this medial side from opening up, basically. It allows some movement, obviously, but it prevents it from totally falling apart when it's in an abducted position, as we'll talk about in a moment. We also have the meniscus, and this provides the joint with a surface to move on, so the femur isn't just moving bone to bone with the tibia, and vice versa. And this also protects against the compressive forces up and down through the joint that are constantly happening, even if, say, you're walking down the stairs. So those are the big players, really. We have some other structures, obviously, PCL doing the opposite of the ACL, and the LCL over here, patellar ligament, the kneecap. We also have some movements. We're not going to talk too much about these right now. We have rotational components. There's some degrees of motion here, rotating inwards and externally as well. Adduction and abduction. Abduction is more of the conversation today. And this, in the context of skiing, is where the knee moves towards the midline and the ski moves away from the body and the foot moves away from the body. So we could imagine if the MCL, for example, is right on the inside here, it's going to provide some freedom there, but when you get to a certain point with a certain level of forces, that thing is ready to rupture. And we also have flexion and extension. And this is basically, if you want, you can imagine this is basically when you're sitting on a swing set, swinging back and forth. This is flexion and extension of the knee. So looking at skiing, we have to consider that none of these movements are ever isolated. You can see in this skier all of those movements we just mentioned are happening at the same time. And it's hard to see the rotational component sometimes, and it's hard to feel the rotational component. It's very easy to see flexion and extension happening here, and adduction and abduction as well. But all of these movements happen simultaneously, and that makes things really complicated when we start to talk injury and studies and how we can quantify, this is the exact moment, or this is the exact combination of scenarios, or whatever. It gets real dicey. This figure here shows a pretty classic scenario of an ACL tear. The skier is making a right-hand turn, and the weight is distributed on both of the feet, and at some point there is a loss of control of the uphill ski. And this places all of the force onto this ski, the person places all of their weight here, and the right ski actually gets caught, the inside edge gets caught. And basically what happens is there's a restriction of movement in both of the skis and both of the legs, but their center of mass is now moving downhill still, and they're also moving backwards. So this simultaneously is going to cause an abducted position. The knee is coming down here and the foot is coming out. They're falling to the left and they're also falling backwards. And that backwards movement, posterior movement of the center of mass, is going to put stress on the ACL, and they also have stress going on their MCL there. It's also important to consider that the skis place different levels of forces on the body than just than any other sport, really. This is because the ski itself generates a moment arm, and this creates torque. So we can see here, case 1, this skier is falling backwards, and it's a very similar situation. You can see kind of the same characteristics of this outside ski, downhill ski. It's kind of hard to tell from this image, but all of their weight is here, and it's on the tail of the ski too. And the force on the tail of the ski is pushing the ski and creating an internal rotation torque. And here, same situation. The downhill ski takes all of the weight, and we have ground reaction force coming up from the inside edge, and we get a torque onto the knee into the abduction position, where this knee is coming down, the ski is going up, and it just, these moment arms just multiply the force, and we get an incredible amount of force acting on the joint. So there's a few different reasons why we might have different size skis, and it comes down to practicality, what we can afford, what we need, what we want, the skiing experience, what we're trying to do. Some people only go out and ski when it snows, or they attempt to do that. They attempt to ski powder all the time. Other skiers maybe are mostly skiing groomers, and this is becoming more prevalent with a lot of man-made snow in some areas, and also marketing. Maybe your favorite skier skis a certain ski, and you figure if you buy that ski, you could ski like them. And it's all up to what we can access and what we want. So yeah, it comes down to the individual preferences. This study uses 3 different ski widths: 65 millimeter, 88 millimeter, and 110 millimeter underfoot. In the ski and science world, there's not really a set definition on what makes a ski wide. Some studies would place 88 underfoot as wide. And in some ways, the 88 and 110 act more similarly to each other than as compared to the 65, as we'll see in some of the results of this study. So what the researchers are thinking here is that this additional width of the ski is going to create different mechanics in the knee, and the forces placed upon the body will be different because of the way that the force is transferred through the joint, and because of the way the ski generates a moment arm, as shown by this little visual here. And we also have a photo showing kind of their idea. There's a greater angle here, and this is that same, we can see those images before that we were looking at are a little bit more dramatic, but it's the same situation where if this skier was making a pretty aggressive turn and they lost control of this uphill ski, for example, and they came crashing down, that knee goes into an abducted position really bad. And there's a rotational component as well, then you're in trouble. So the purpose of the study is to quantify the effect of ski waist width on the knee joint. They hypothesize that the wider the skis, the higher the occurrence of knee joint abduction and external rotation. And this is specifically happening on hard snow conditions. Shout out to Fatipus skis and their 140 underfoot Elata. Pretty sick ski there. So this is basically a little diagram showing what they're thinking is going to happen. We get this, what's called knee valgus, boom, and the external rotation here. And there's a little gluteal muscle weakness here, which has nothing to do with the study directly, but we'll mention it at some point. So what they did was they had a group of skiers and 3 different skis, and they set up some gates on a course, had them ski with some fancy GPS systems and like gyroscopes and some equipment to measure all of the kinematics and what was going on, joint angles. And they divided these turns into 4 different phases and compared the peak angles in all of the different planes of motion. And they found that the narrow ski actually had the highest amount of abduction and internal rotation. So this was not what they expected. They were hypothesizing that the wide ski would have created greater abduction and external rotation. And it's important to note here that the wide ski is at the lowest internal rotation, which could also be interpreted as a greater degree of external rotation. So they say, quote, the main finding of the study was that the kinematics of the knee joint in the turn while skiing on a hard snow surface depended on the ski width. So they increased the ski width, they had a decrease in abduction, and this should actually, yeah, that's correct, never mind. Abduction and internal rotation. Their hypothesis was therefore rejected. So what actually happened? Why did this happen? It's potentially a strategic adaptation. They say it's a reflection of the 2 different strategies of coping with the biomechanical requirements of the ski turn, which basically means there's different mechanical requirements based on how the ski is interacting with the snow and with their knees, and the skiers are just skiing differently based on the required movements to execute their turns. Now some people, some authors and critics, I guess you could say, try and make the claim that the wide ski could potentially be increasing the potential for injury in this lens of what is called range of motion reserve. So here we have a little figure showing the internal rotation and external rotation at the knee. And we can see here we have 30 degrees of internal rotation, potentially, and minus 40 degrees of external rotation. Now the argument that some people are making is, let's set up an example here where a skier is riding a narrow ski and they're at 20 degrees, and I'm just making up these numbers. They're at 20 degrees of internal rotation and there's some perturbation, something happens and they lose control of the ski and it very quickly goes into external rotation. If they're at 20 degrees and they go all the way to minus 40, they might still be fine. Their knee is still safe. Now, if they are skiing a wide ski and they're at baseline of, let's say, 10 degrees or minus 10 degrees external rotation, and they experience that same perturbation that they experienced on the narrow ski, now they're going to end up well beyond their threshold of manageable external rotation. So, in this sense, there's a potential that the baseline, higher level of external rotation could provide a risk to the skier in the wide ski. Now, this is just a lens that was taken to potentially, give reason or give a risk to the wide ski. And the reality of the study is that all that Zorko et al. Really found was that there is a difference in the way that we ski and the way that our knees react with wide skis. And they do demonstrate that, there's a difference in the way that we control the ski. And the reality is that the injury typically happens when we lose control. From looking at this study alone, we can't really make any claims about the likelihood of injury increasing or decreasing with either ski width. And there's some reasons for that. And there's some limits to the study and things we should just consider in general. Firstly, the study is only looking at kinematics. That means we're only measuring the joint angles and not necessarily measuring the joint moments. Those are what is generated by the ski and the torque that we were talking about. And it's not explicitly measuring the ground reaction forces or the physiological strain on the structures of the knee, like the ACL or the MCL or the meniscus or anything. The injury risk is completely inferred. And there's no direct measurements of the loading happening in the different directions. And the argument of the reduced range of motion reserve is completely conceptual and is just a lens to view the potential situation. Also, the skiing was completely controlled and doesn't include many natural skiing scenarios, such as variable conditions, fatigue, or, being a novice skier, being previously injured. And there's also other considerations, physiological. There's anatomical differences between men and women that might put women at a higher risk for these knee injuries. In the natural differences in the structure of the hip between men and women. And again, this wasn't considering previous injuries, and there's other considerations. The gluteal muscles, glute med, specifically, is very strongly related to outcomes in knee injury and re-injury. We're not going to talk about that a lot today, but the reality is that skiing is dangerous, and there's nothing that we can do to prevent that. And should you buy wide skis? I mean, it depends on what your goals are and what type of skiing you're doing. We have to be honest with ourselves and ask how many POW days are we really skiing a year, and how deep is that snow? I think for many of us, we're not skiing neck deep powder every time we go out. Maybe there are a few people who get to, have that opportunity, but I know I'm not one of them. Yeah, it comes down to personal preference, and my big question is always, would you rather be in it or on it? And I would rather be in it. So thank you for watching my video. I hope I didn't make too many mistakes, and if I did, please let me know. Otherwise, I will be back for another. Peace, peace.